Hi, good evening, everyone. My name is Dr. Jaspreet Singh, and tonight we're going to be talking about testicular cancer. I welcome you to the webinar, and thanks for joining us. Before we get started here, just kind of wanted to take the opportunity to introduce myself. For those of you who don't know me, again, Dr. Jaspreet Singh. I'm one of the board-certified urologists at Premier Medical Group in Hudson Valley. And I've been a urologist here at Premier Medical Group for the last, oh boy, almost 12, 13 years. And I grew up here in the Hudson Valley, did my training down in Philadelphia, where I did a surgical oncology fellowship, and then have returned back to where I grew up in the Hudson Valley. Um, we'll discuss a few things regarding testicular cancer, as that's our topic today. And if anybody's looking for further information, can look me up with an easy website, www.singhurology.com. And if you're looking for further information and actually consultation in the office, my main office is at in New Windsor at 955 Little Britain Road, and the office number is 845-437-5000. And so again, the topic for this evening is testicular cancer. Protect your pair. And just like these boxing gloves, us men understand how important protecting our testicles are, and hopefully shed some light on the importance of testicular cancer, of which is the most common type of cancer in the young men. And again, another important thing to point out that this is the month of November and part of our Men's Health series. We wanted to kick off by talking about testicular cancer, and we have several other hopefully engaging presentations and webinars over the course of this month that will be highlighting and discussing other men's health issues. So testicular cancer is in general it occurs when abnormal cells in the testicles divide and grow uncontrolled. And this goes for any type of cancers or tumors. Anytime one is facing the diagnosis of cancer, what's happening is there's cells that are reproducing at an abnormal rate. And when these cells are reproducing at an abnormal rate, may present as a lump, like in the testis, or can eventually outgrow their blood supply and then seed into the other parts of the body. And so, basic principle of any tumor is based on the fact that the mechanism that stops reproduction, kind of like the brakes of the car, have malfunction, or the the signals that reproduce cells have gone haywire, or for example, stepping on the accelerator too long causes the car to go in a fast and uncontrolled fashion. So similarly, it's either to the pedal, putting the foot on the accelerator pedal, or not utilizing the brake. And there's similar a problem here in the testis. The nice thing about testicular cancer is that it's highly treatable, and cure rates are exceeding 90%. And one of our poster patients that fought testicular cancer was Iron Man himself, Lance Armstrong. And Lance Armstrong, when he was diagnosed, was actually at stage 4 testicular cancer and was able to beat the cancer and you know uh, recover from it and participate in the Tour de France after his treatment. And so, although in general it's a rare tumor, it is the most common tumor in young men. Now, why would one have the risk of developing testicular cancer? And as long as there are risk factors for different various tumors, for example, smoking with lung cancer, the the biggest risk factors for testicular cancer include age. So as I mentioned, it is of the young men, typically between the ages of 15 and 40. Any men who have a history of an undescended testicle, or what we call cryptorchidism, The undescended testicle is at a much higher rate of developing testicular cancer in the future. And so for men who have had an undescended testicle at birth, we often, as pediatric urologists, will work on bringing that testicle down into the scrotum. Now, that doesn't necessarily decrease the risk of future testicular cancer, but what it allows is now the testicle to be palpated. So as the young boy grows into manhood, that he will be able to self-monitor for any abnormalities of the testicle. Family history is important, and as well as many of the other cancers that we treat. So if there's testicular cancer with dad, it's a higher risk of that, and testicular undescended testicle also has a familial risk. Other possible risks, although there's nothing concrete, but there's a thought process that chronic testicular infections may increase the risk for testicular cancer and chronic immune suppressive diseases like HIV. And so we divide testicular cancer into two main branches. We have what's called a germ cell, which is the most common type of testicular cancer, and non-germ cell tumors. And then extremely rare are what we call secondary testicular cancer. Uh, uh, this I have helped and treated men who perhaps have a testicular mass and are we take to the operating room and find out that it's a metastasis or spread from another part of the body. Or I've addressed men who have had benign conditions like sarcoidosis, which typically affects lung disease, but it's granulomas or these growths. They're benign, but can deposit in the testicle as well. So when we talk about germ cell testicular cancer, they're divided into two main branches, seminoma and non-seminoma. Seminoma in general are slow-growing cancers that primarily affect men in their 40s and 50s. Non-seminoma, on the other hand, tend to be more aggressive because they are rapidly reproducing, much more rapidly than seminomas. And it typically affects men that are younger, perhaps in their 20s and early 30s. And there are four types of all right, but in let's get back to the slideshow here. Okay, but in general, there are seminomas tend to be have a more indolent uh, pattern as opposed to non-seminomas tend to be more aggressive. And so where are these testicular tumors arising from? And so here's an anatomy of what the testicle looks like. And we see here at a microscopic level, these cells are called germ cells, and they're responsible for the production of sperm. And what happens with testicular cancer is that certain germ cells will start reproducing at a more aggressive rate than the normal cells. And so that's what we classify tumors as, um, is an abnormal growth. And this eventually, the reproduction of these cells will go from one cell to two to four to, eventually millions of cells, and will lead to what will be a palpable or a lump that one can feel. So testicular cancer can also occur in the supportive and the hormonal cells in the tissue of the testicle. And so germ cells, as I mentioned, are important in the production of sperm. Leydig cells are important in the production of testosterone, and Sertoli cells provide um, a network of support to the sperm cells that are being produced. And so not as common, but the other main two types of non germ cell tumors are Leydig cell tumors and Sertoli cell tumors. Now, there are certain tumors that can metastasize from other organs to the testicles, so it's not primary testicular cancer. And obviously, a history is important. If somebody has a history of prostate cancer, lung cancer, kidney cancer, or perhaps colon cancer, these can all spread to the testicle. Um, also, not to leave out melanomas are also known to spread into the testicle as well. Um, Metastatic tumors are rare, and how would we know? Really depends on one, the history of the patient. If somebody has a history of primary tumors elsewhere, our suspicion of metastatic disease rises, and obviously from biopsying the testicle. Are there any signs and symptoms of testicular cancer? Now, most of the time, the growth in the testicle is painless, and this occurs over a period of time. So that's why it's so important for men to examine themselves to get a better sense of what a normal testicle feels like, and then be on the lookout for any sort of changes. And so um, these lumps or these growths for most men are painless. Men will describe perhaps a heaviness feeling in the scrotum due to the growth of the mass. When the testicular cancer will be aggressive or spreads outside the testicle, one can develop abdominal pain and weight loss from the tumor growth. And also, what would be concerning are other less common symptoms like enlargement of the testicle or nipples, also breast tenderness. So you want to be sure that, um, the mass or the growth in the testicle does not necessarily have to be painful or tender to be concerning. Now, when you go to the doctor, it's very important for the doctor to get a full history in better assessing how long this has been going on. Perhaps there is an inciting event where perhaps a young boy was physically active and suffered trauma to the testicle, which may result in some bruising or a lump. But the history is important. And then, of course, the physical aspect of it for the doctor to examine the scrotum to make sure that there's no palpable masses. The texture of the normal testicle should feel like the palm of your hands. It should be smooth, should be slightly soft. What would be concerning is something that would feel like the knuckle, where there's a lump or firmness, which is distinct from the rest of the testicle. How would we know as providers? Well, one, physical exam, but also very common to obtain an ultrasound of the testicle to further evaluate this lesion or the mass. Now, what are we finding when we do an ultrasound? As you see here on the ultrasound, what you can see is the outline of a normal testicle. The normal testicle pattern looks like that of those old school TVs where the channel is grayed out. What would be concerning is something that looks dark on ultrasound, or what we call hypoechoic. And as you can see, it's a distinct mass. Doesn't always have to be symmetric and round, and you can see the irregular borders of this lesion. There are other blood tests the doctors can order, specifically something called the human chorionic gonadotropin, or ACG. ACG is actually also found in pregnant women. It is produced with the placenta and also produced with germ cells, the same similar kind of primitive cells that are seen in the placenta. And so HCG is a blood test that we check, and also something called alpha fetoprotein, or AFP. There are obviously other conditions that can cause an abnormal AFP that are not necessarily related to testicular cancer, and one that comes to mind is liver disease. Of course, as mentioned, ultrasound is important. And also for staging purposes, to better assess if the tumor has spread outside the testicle, a doctor may order a CAT scan of the abdomen and pelvis, and perhaps also a PET scan that if there is an abnormality in a CAT scan to see if there's anything concerning or metabolically active that the PET scan can show. All patients with a solid testicular mass should be regarded as tumor or cancerous until proven otherwise. So the old adage when I was a resident is that if anybody presents, especially a young man, with a mass in the testicle, it's cancer until proven otherwise. So it's very important not to ignore that and to do the appropriate workup, which can include blood work and imaging as mentioned before. Now, how do I, as a urologist, manage men who have testicular tumors or a mass? Well, a lot of this is dependent on the growth itself. And as the ultrasound that was shown, if there's a concerning abnormality on exam and ultrasound, and the tumor markers being abnormal, the patient is counseled on going to the operating room. The first line of treatment is the removal of the testicle. And the way that the testicle is approached in the removal is not through an incision in the scrotum, but rather in the groin area in the inguinal region. And the reason for that is the lymphatic blood supply, where the tumor cells can escape, the lymphatic channels to the testicle actually arise from the mid-abdomen. So as in the fetus, the testicles are actually in the abdomen, which eventually descend down into the testis as the fetus matures. And so the blood supply and the lymphatic supply actually arises from the mid-abdomen. So the incision is important to make in the lower groin to keep the lymphatic channels contiguous and without violation because the lymphatic channels of the scrotum are different than the testicle. And so the first line of treatment is removal of the testicle, which then gets tested by the pathologist, who lets us know what kind of tumor. And remember the different types, the germ cell or non-germ cell. And then of this germ cell, seminoma or non-seminomatous. So there's testing on the testicle, and the treatment is then based on what type of tumor. Seminomas are usually treated with just the removal of the testicle in early stage and don't often require additional treatment. But a lot of non-seminomatous disease, even in stage one, may require other surgeries, such as removing the lymph nodes in the retroperitoneum, or what we call the an RPLND. And this is not only important for staging purposes, for also ensuring the appropriate cancer cure. For some seminomas, one can be offered radiation therapy that's given to the abdomen and to the same side of the groin, and also chemotherapy, depending on the stage. For early stages, perhaps one course of chemotherapy is adequate. But if the testicular cancer has spread into the abdomen or elsewhere, it may require longer term chemotherapy. And so, the importance of a testicular exam cannot be emphasized enough. One, it's easy to do. Two, it's free. And three, you could do it at home. What you want to do is to get into a regimen of examining your testicle in a warm shower, and typically once a month is a good kind of a marker or a good time period to check the testicles. What what one needs to do in a warm shower, and the reason for the warm shower is that typically the scrotum is nice and soft and it hangs looser. It's easier to feel the testicle. You want to grasp the testicle with both hands. You want to be able to then use your thumb and your index finger to slide over the testicle. Now, often patients will say, Doc, I don't know what I'm feeling for. Well, the important thing is when you're at the doctor's office to understand that the testicle health is normal so that you can get an understanding of what normal feels like and be able to then compare if there is a change, bringing that change to your doctor's attention. What you want to feel is a firmness or hardness, a lump within the testicle. And so again, this is very easy and easy to learn and easy to do. So as we share and start off Men's Health Awareness Month and the month of November, I encourage all of you men to take your health in your own hands and make sure that you keep up with regular checkups with your medical doctors and also with your urologist to ensure that your men's health is optimized. I look forward to sharing other webinars with you in the upcoming month, and I look forward to seeing you next week.